So I see nothing but positive things coming out of this partnership.
That's a non-starter for me. It's a billion-dollar public asset that's owned by the people of Tallahassee.
That we have a state government that has no problem being intrusive in areas where it doesn't belong.
Like I said, I don't want to pass judgment on something I know nothing about. There are way too many people doing that right now.
Hey, Tristan.
Hey, Gina, it's good seeing you.
Good to see you. You have been busy. You've been following this big, what we think is we don't know what it is. There's an announcement between Florida State University and Tallahassee Memorial Healthcare about a partnership. What's going on with that?
So they want to join forces to create a new academic health center and slowly rebrand all of TMH's assets to FSU Health. In an email announcing the news last week, FSU President Richard McCullough praised the partnership. He says it will help FSU to expand its current research and education efforts while advancing healthcare access in the region.
Okay, so they're calling it a partnership.
Mm-hmm.
We don't know that there will be a sale by the city of Tallahassee. We don't really know anything yet. Did they say anything other than that?
So in this 2-page announcement letter, it was pretty slim on details. We do know this, though. Tallahassee Memorial Healthcare is currently a city-owned asset, but it's operated by an independent nonprofit entity under a 40-year lease agreement with the city of Tallahassee. That lease agreement is for $1. Sitting on the board that controls the nonprofit are several prominent Tallahassee business owners and other healthcare professionals.
Right. So this new arrangement, how might that impact the current situation?
Well, we don't know much yet, but what we do know is that the proposed plan would form a new board with members of the Florida State University Board of Trustees having 8 members on it, while TMH has 9 members on it.
Mm-hmm.
It would still give TMH board members majority control, essentially.
Why is this happening now? Was there a catalyst for this?
Well, FSU wants to build this hospital and grow its health program to be able to conduct more research and be able to train more students. It's coming at a time where healthcare needs in the Panhandle are growing rapidly because populations in Leon and surrounding counties are aging. And people that tend to move there are generally older, especially as you get closer to Panama City and further in the Panhandle. They're already working with TMH to build a hospital in Panama City, and this agreement will likely mean FSU is ready to invest more money, a lot more money, in expanding healthcare research and access in Leon County. Also, having a research hospital could mean more jobs for the people that live here already, even outside of medicine. Think about it, higher paid researchers, lab assistants, or medical students in training that have to live and work here, spend local money to go to all the stuff that those people would spend money on. Think about arts and culture stuff, restaurants, other leisure activities, stores, the whole 9 yards.
Yeah. I mean, it sounds great. It's just that there's a lot we don't know about it.
You're right. There's quite a lot that we still don't know. We don't know what the power sharing will actually look like. We don't know whether they'll be asking the city of Tallahassee to sell the asset. We don't know how this potential transfer will affect anyone currently on TMH staff. And most consequentially, we don't know whether the city of Tallahassee is going to even give it the go-ahead. The commission hasn't even heard it yet, and they're scheduled to hear about it on October 1st.
Mm-hmm.
But as I went around town interviewing people about their thoughts about last week's announcement, a lot of them expressed concerns about how the agreement was drafted behind the scenes without a lot of public input at this point. I ran into Clinton Bird while I was at Cascades Park. He says he thinks FSU is trying to be like the University of Florida, my alma mater.
They want Gainesville and Tallahassee, and we've got to stop this thing of competing to the standpoint that everybody wants to be number one.
And thinks the plans for the hospital are already cooked up.
These behind-the-scenes discussions and then come out like somebody is really supporting something like it's new and fresh. No, these ideas have been there for a long time. And so that type of, if you just be open with the people will support you, because if it's a good idea, it deserves our support. But the way it was done was what people are responding to, and people just don't like to be played with like that politically.
He also said he thinks the control that the citizens of Tallahassee have over the hospital is already very limited.
So local people don't have control right now, even though the city commission and all of that, even though they own the facility, it's theirs.
I think a lot of folks probably do agree with that perception that maybe this was done hidden. It was behind closed doors and hidden from the public.
Yeah, several people I spoke to when I went around town talking to people said that to me. I met with Jeff Mandel at Black Dog Coffee. He's been in town since 1983. He's concerned about whether healthcare controlled by Florida State University would get more expensive for patients.
And, we can't go to a situation where we have two hospitals, but that do not serve people without insurance. That's my biggest question. I'm not against the concept. I think having a teaching hospital would be a good thing, like Shands is for Gainesville.
Tristan, to his first point, I thought hospitals had to treat you regardless of your insurance status.
Now, that applies only to emergency care, not necessarily like long-term like surgeries or stuff like that, just general other procedures outside of emergency care. He goes on to say he's also concerned about how the state government controlling the hospital would mean about the type of access that's available at the hospital.
Our current state government, which is going around to schools and ripping books out of libraries and painting over safety displays on streets because they say, oh, it promotes the gay agenda and all that. We have a state government that has no problem being intrusive in areas where it doesn't belong. And yes, I have a concern. They may decide that medical care has to be limited to their political agenda. So if a trans person needs care, they might authorize hospital and in fact force hospital to not provide that care.
So Tristan, for the record, we should say that FSU and TMH put out a statement. They say that patients will be able to keep their same doctors. Charity care, as they called it, will continue. And they say that TMH's policy for uninsured or underinsured patients will remain in place. But I know a lot of people are worried about that.
Yes, like Raymond Fanoff. I found him walking around Lake Ella. He said he doesn't want to pass too much judgment on the agreement until those other details are out, but he still says he has some concerns.
Are they still going to be accepting my insurance? What are the prerequisites? I want to make sure that it's still going to be inclusive, that it's not going to be segregating people out of it. When it was TMH, it was a much more open policy. I don't know what it's going to be like with this new affiliation. And like I said, I don't want to pass judgment on something I know nothing about. There are way too many people doing that right now. If they don't know what the facts are, they make them up. I don't want to have that either. I'd rather have an informed decision based on the facts.
He also has questions about how the leadership at TMH and FSU will be divvied up.
Well, I'd like to see what the level of involvement, who's going to be steering the boat, what's the agenda, what is their intended outcome for this merger. I mean, obviously, if it's beneficial to the hospital and the population at large, that'd be fantastic. But if it's something that they've already got an agenda for, I don't know. Like I said, I don't know enough about it. I heard about it 2 days ago, but very, very little, and very little has been put out since.
Now, something else that's important to keep in mind is as I went around town and I spoke with dozens of people at these public meeting places about their thoughts on this merger. Most of the people I spoke to didn't want to talk to me on record, and most of those people that didn't want to talk to me were working age people, and a lot of them, some of them work for TMH and or for FSU. It's important to keep in mind that as these conversations are going on, a lot of people that could be impacted are employed by FSU and TMH. They're some of the biggest employers in the capital region, and that might impact, whether some people feel comfortable or not coming forward and stating their opinion.
Yeah. So a lot of worries about this. Whether this is a sale, we don't know. They're talking about it like a partnership, but ultimately it's up to the Tallahassee City Commission. So what are the commissioners saying about this?
Some commissioners have given me their preliminary thoughts. City Commissioner Jeremy Matlow has been one of the loudest voices against the deal, saying he doesn't want to transfer any local assets to the state.
We got the letter saying that they're interested in a transfer of the city's hospital to Florida State. I think that's a non-starter for me. It's a $1 billion public asset that's owned by the people of Tallahassee, and the fact that we would just like hand it over or transfer it to state government and Ron DeSantis in this climate seems kind of insane to me.
On the opposite side of that, Commissioner Curtis Richardson has come out leaning in favor of it, saying it would be good for people across the region.
Well, I think that it's a very positive move towards increasing the quality of healthcare in our community and in our region. It's the kind of partnership that we hoped that FSU and TMH could arrive at in providing healthcare in the area. And so I see nothing but good things coming out of this kind of partnership. Certainly, there will be financial benefits to it from what I understand.
Okay, so we are a year out from the 2026 elections. Mm-hmm. We've got 3 city commission seats that are up for election next year. Diane Williams-Cox is running for re-election. Jeremy Matlow is not running for re-election because he's running for mayor. And then Mayor John Daley is not seeking re-election. So how might these political changes impact what's happening with this situation?
Certainly. There's a lot of political implications here. Matlow is running for mayor and has been trying to mend fences with members of the Tallahassee Chamber of Commerce, as he's been trying to build that coalition for support. Mm-hmm. Some prominent members of the chamber are involved with TMH leadership. Now, Richardson, as well as Williams, Cox, and Daley, have historically sided with FSU on controversial issues, like the $27 million to Doak Campbell Stadium renovations through the Blueprint Intergovernmental Agency in 2022.
Yeah.
Political committees that have spent money in past elections to support those 3 candidates have also received a lot of donations from members of the FSU Board of Trustees. Now, if one of those trustees is watching this, I'm not bringing that up because I'm a WF grad. I'm just doing my job.
You're a double UF grad?
Yes.
Well, you're just the messenger. Yes. Okay, so what are the next steps in all of this?
Well, they're having a special meeting on October 1st at 9 a.m. at City Hall, where city commissioners are going to get a presentation from TMH and FSU about the agreement. After that meeting, for now, they're going to have a public appearing on a later date. They'll be later on in the evening, so more members of the public can come, not this 9 a.m. meeting.
Yeah.
The city commission has actually already had some discussions at their meeting last week about what they know about what the process is going to look like for this public awareness campaign that TMH and FSU is doing, and what public approval process they're going to do.
The discussion about the TMH-FSU merger started at last week's meeting, with Matlow proposing laying out a longer process and giving the decision of the merger to voters.
So what I would propose over the next few months, and I think we can bring this back as an agenda item on the October 1st special meeting, is to lay out the public process awareness campaign of what type of partnership they want to enter into, what the city's role and ownership is, and then if it is the desire that we want to explore transferring or selling the ownership, my position would be that it would be, minimum would be fair market value of near $1 billion, but I think we should set up a process for the citizens to weigh in. And I think the most transparent way to do that is to go to referendum and put it on the 2026 ballot at such a large purchase by Florida State that will be so impactful to our community. I think that's a decision that we need to hear from the citizenry and let them weigh in on. So I'm going to make a motion that at the October 1st meeting, we bring back an agenda item that lays out a process to bring this decision to referendum.
Diane Williams-Cox disagreed with that course of action, pointing out that getting something on the ballot takes time, and that also there wouldn't be enough time to get the word out about it to residents by 2026.
So Commissioner Matlow, you said a referendum for 2026? Yeah. And as you recall, when we did the charter review, in order to have something put on the ballot, we have to follow the process of the supervisor of elections schedule. And I don't know where we are in that cycle, but and to add this to a midterm election where we know turnout is always very low, I'm not sure if we would get what it is that we need. I'm not sure that at this time we have enough time to even be able to do that. But I like the processes that we already have in place. We already have the structure for a public hearing. We an agenda item comes out, like we do here, agenda item comes out with the information that we need, and we're available to get briefings. All of us received a letter. We received what Kyle sent. If we have questions, we can talk. We talk to whoever we have access to talk to whoever we want to talk to. We also can go out and talk to our constituents and share with them information. The public hearing, I think, is necessary. I absolutely support the public hearing. I just do not think that we have ample time. Here it is, September, almost October, to follow the process for getting something added to the ballot for next year, based on what we had to do previously to do that. I'm all for voting if that's where we need to go, but I think that we need information before next year about where our public stands on this. The information that is being shared out on social media is very positive.
Williams-Cox also said waiting to get it on the ballot could draw out the process.
We need folks to they can either come in here and talk to us, they can reach out to us. I'm happy to go into the community to hear what folks want me to hear. I just don't think that waiting until 2026 is what we really need, because this is going to take some time. It's going to take some time to get all these things in place. So the fact that the community has already been informed that we have 2 public hearings, one in the morning and one in the evening, to be able to come out and share what it is that they need to share. I think that's a great start, considering we've only had the letter from the joint statement from those 2 entities less than 48 hours. The city has already responded with 2 public hearings scheduled.
Commissioner Curtis Richardson also opposed it, saying the public isn't informed on the issue.
I guess the issue that comes to mind for me is even if we were considering putting this on the ballot in 2026, what is the process for informing an uneducated public, and I say uneducated, about the health issues that will be addressed in this MOU, to the point where they can make a now informed decision about the future of health care in this community? So that would be my first question. And then secondly, has anyone had this kind of conversation with FSU or TMH to see if it's something that they would be interested in? I mean, they've put in hours of negotiations to come to where they are now. Are they interested in this being put on a ballot referendum in the fall?
Matlow disagreed with those sentiments. He says how quick these public hearings are coming seems rushed.
Commissioner Richardson's idea that the public would need a lot of time to really digest how this decision impacts it, and I would argue so does the City Commission. We haven't had much time to digest this much information. We're not health professionals, and I think we definitely need adequate time to engage with our constituencies, health professionals, when we're talking about $1 billion decision. I'm not understanding how we can have a public hearing because this body hasn't given any direction or any inclination that it's even interested in this stuff yet. So we can't go to public hearing on October 1st until we have those conversations. So I think it's great to have that meeting, to have a discussion around the MOU and look to where we're going to go next. But it certainly wouldn't be a public hearing because we don't have an agenda or any direction to develop an agenda at this point.
Mayor John Daley pushed back on that.
On every issue that comes before this body, we always take public comment, and we're having a public hearing. Okay? We will always take public comment, and we'll have the public hearing as well. Okay? And then we have the second meeting that's
6 p.m.
That will also have the public hearing at 6 p.m. as well. So we will ensure that there is plenty of opportunity for discussion moving forward, and public hearing and public input.
Ultimately, Matlow's motion was voted down 3-2.
Because I think it's a little premature, Commissioner Matlow. I look forward to the special meeting that the manager called in conjunction with myself in consultation. It's a big issue. It's an exciting issue to have the unanimous vote coming out of the TMH Board of Directors and to have unanimous support from Florida State. I look forward to hearing what they have to say. None of us were part of those negotiations, and so it's exciting to hear what they have to come and present. Once they present, we'll have an idea what we're dealing with, and I'll feel comfortable moving forward from that point. But I'm not going to support any motions in regards to the proposal until we actually hear what they have to say.
That vote to not do that public referendum for now did grab the attention of at least one local political candidate. Teacher PJ Perez, who's running for the city commission seat in Matlow, is leaving to run for mayor, had this to say at his campaign launch party this weekend about the voting down of that ballot initiative issue.
The last city commission meeting on Wednesday, if you're sickos like me, and watch it. But there was a motion filed to put the TMH the TMH FSU proposal for a ballot item, a referendum in the coming year, 2026, and it got voted down, strangely. You would think this is obvious. You bring it to the people, let the citizens decide, give us a year to think about it, and that motion was voted down.
Now, this is also worth noting, Perez is tight with Matlow's aide and Leon Democratic Party chair, Ryan Ray, who introduced him at the launch party.
So you're covering elections, you're covering the TMH FSU partnership merger thing. You're going to be pretty busy for a few weeks, Tristan.
Oh, Gina, trust me. Tell me about it. Tell me about it.
So I'm sure a lot of people have questions for you. You'll be covering this upcoming meeting. How do you want them to reach out to you with questions that they hope you'll ask?
Well, they can shoot me an email at tristan@wfsu.org. That's Tristan. You can also follow me on Instagram at Tristan_Wood. As in, if your friends jumped off a bridge, would you?
Would you?
Exactly,
Yes.
exactly. They didn't have Wood, W-O-O-D, like my last name, for a handle, so I decided to make a little pun out of it when I was making my handle.
I think that's a great pun.
Thank you, thank you.
Nice chatting with you, Tristan.
Nice chatting with you as well.
Don't forget to like, subscribe, and give to your local public media station. I'm Tristan Wood with WFSU Public Media.